what can CBD possibly do for younger adults or some middle-aged adults who are at clinical high risk for psychosis? That's the question. I'm Dr. Jim, and I've got some information for you. I've been reading some fascinating studies, really digging in deep, looking at clinical research, and I have an answer for you. So there's a condition, some people call it prodromal or clinical high risk for psychosis. And this is a very serious mental disorder. Why? Because it can lead to prolonged periods of disturbance or a full-blown diagnosis of schizophrenia or other psychotic disorders. And we know that there are a lot of antipsychotic medications out there, right? But they may work, they may not work, and when they have bad side effects, a lot of people will just stop taking them, rendering them, quite useless. So these antipsychotics come with sometimes unwanted side effects and sometimes very dangerous side effects. Since early detection and treatment is crucial, so this is prodromal, pre-symptoms of an oncoming psychosis. If we catch it early and we treat it early, which is crucial, and we're using safe and well-tolerated interventions such as cannabidiol or CBD, well, this is something that we should really be looking into. And according to what I have found, there are researchers who are taking this quite seriously. Allow me to explain prodromal or clinical high risk for psychosis for a moment. Prodromal, that word, refers to a period of time between the appearance of initial symptoms of a condition, in this case, we're talking about psychosis, and the full development of schizophrenia. Clinical high risk indicates early symptoms that a younger person may have and the risk of developing a fully diagnosable psychotic disorder like schizophrenia. And there is a very high level of accuracy of prodromal symptoms predicting the onset of psychosis, making early detection and treatment possible, which leads to a better prognosis in the short term and in the long term. So symptoms and behavioral difficulties, let's throw them in, that are associated with clinical high risk for psychosis, important to look at. Younger individuals who are at a high risk of psychosis generally exhibit coexisting conditions. One psychiatric condition barely exists and lives on its own. There's always some other type of condition going on, co-occurring, and they are depression and anxiety mainly, but they may also show other symptoms throughout their prodromal stages of psychosis, including the following: social withdrawal, isolation, bizarre behavior or appearance, emotional outburst or emotional flattening, hypervigilance, suspiciousness, paranoia, mistrust of other people, poor hygiene, poor concentration or difficulty thinking clearly, difficulties wherever they might be, in school, at a job, in their career, social settings, interpersonal relationships, the entire sphere of life. So researchers are looking at CBD and clinical high risk for psychosis. I just put down a fantastic article last night. The article published in the journal World Psychiatry provided evidence on the effects of cannabidiol or CBD on symptoms of clinical high risk psychosis. 33 experimental subjects or people were divided into two groups. And this is a quote from the study. Quote, using a parallel group, double-blind, placebo-controlled design, participants were randomly allocated to either CBD and equals 16. They had 16 participants, or placebo. And the people on the placebo, the N or the number was 17, making a total of 33 experimental subjects. End of quote. The CBD group received a CBD capsule, and the experimental group received a capsule that looked identical to the CBD. So they had no idea what they were taking. And they took these for 21 days. The dose of CBD was 600 milligrams daily, and that's a bit. That's quite a bit, but therapeutic and safe. Okay, so the dose of CBD was 600 milligrams a day, and it was both effective and well tolerated among the subjects of the experiment, meaning there were no side effects. The subjects were administered a couple of tests. One is called the Comprehensive Assessment of At-Risk Mental States. And the other one was the Positive and Negative Syndrome Scale, prior to and after the study. The results were positive, and that's why I kept reading. I was very hopeful about this. Those who received 600 milligrams of CBD daily had a lower score on both tests, both scales. They reported less distress associated with psychiatric symptoms, and they overall showed very good signs. Although the sample size was small, and if you're a scientist out there, you're going, yeah, Dr. Jim, 33 people, big deal. My response is you got to start somewhere on that, right? Let's get 333 people, 3,333 people eventually, but you have to start small, I guess. Although the sample size was small, I'll admit that, it's not possible to generalize from such a small group. But CBD did, let's look at the positive, CBD did reduce symptoms among those with clinical high risk for psychosis. There was a noted reduction in the severity of symptoms and the level of distress. That to me is good news. So here's my final thoughts on CBD and clinical high-risk psychosis. People who are at clinical high risk for psychosis, they're at a very critical crossroads. They're showing early signs, early symptoms. Now, sometimes these symptoms do not worsen. That's fantastic. But they still go through this prolonged period of distress. There are times when these pre-symptomatic conditions turn into full-blown schizophrenia. And that's what we're trying to nip it in the bud, so to speak there. They may be at the beginning of a very turbulent time in their life, or they might develop a full-blown psychosis like schizophrenia. For those young people in treatment, antipsychotic medications may or may not work, okay? So there is a need for something new, a natural, safe, and effective intervention. One small study that I just shared with you showed that CBD had positive effects on disturbing symptoms associated with psychosis. Hopefully more research will be done in this area, and those who are at high risk for developing psychosis will have a better alternative to antipsychotic drugs. Thanks for your attention. I appreciate it. If you're interested in chatting with me, email me sometimes, jim@collinslearning.com. Thank you for watching the video. I appreciate it. And I'd like to introduce you to my book, Living Longer and Stronger with CBD. I had to write this after reading between 500, 550, 600 medical articles written and published all over the world. I had to condense the findings into one easy-to-read book on the health benefits of CBD for physical disorders, for mental, emotional conditions, for neurological and neurodegenerative health problems. I guarantee you, you are going to find this book very helpful for yourself, for friends, colleagues, family members. It's on sale at Amazon.com, but you can check it out at drjimcollins.com. That's drjimcollins.com. Or follow the link, okay? So thank you again for your time, and check out Living Longer and Stronger with CBD.